Welcome. Today we'll speak about the determinants of health. By the time you finish this session, you should be able to speak comfortably about the determinants of health, including important risk factors and the social determinants of health, assess key global health issues through a number of critical perspectives, and analyze global health issues with a framework that enables you to move from identifying problems to understanding what can be done to address them. Let's begin with a few very brief vignettes. Ramesh is a 3-year-old in India. He weighs about half as much as the average 3-year-old in India. He is also exceptionally short for his age, and he's not growing properly. Juan is a 40-year-old man in Mexico City, Mexico. Juan has diabetes. He also has heart disease and a number of complications of diabetes. Shireen was a young woman in a poor province of Pakistan who died in childbirth. She got married at 16, and this was to be her first child. So let's take a few minutes to understand, with the help of our students, more about Ramesh, Juan, and Shireen. Vivek, why do you think Ramesh is so small and not growing properly?
It's possible that he's malnourished or that he hasn't been properly breastfed.
And Emily, what might you add to that?
He may have been infected with a lot of pathogens that could cause diarrhea, and this might have been prevented if he had proper vaccination.
Okay, and the infection malnutrition cycle might be getting to him. And Shaylin, why do you think Juan has diabetes?
Well, he could work in an environment where he spends the day sitting down. In an urban area, he may not have access to outdoor spaces for exercise, and he may also have a diet that is highly processed and full of sugar.
And Elizabeth, why do you think that Shireen died in childbirth?
Well, it's always risky to have a child when you're as young as Shireen. And also there are societal issues to consider. Maybe she lived in an area in Pakistan where she didn't feel empowered enough to look for a doctor, or it was difficult to get to one to treat the birth complications that she had.
And Rachel, would you like to add anything to that?
Yes, Shireen may also have been malnourished or in ill health herself before she became pregnant, which would have made the pregnancy even more high risk.
Excellent. Let's look at a slide that puts together some of the comments of our students and shows you what we call the determinants of health. As you can see, one can think of these determinants as moving from those factors that very directly influence your health, such as your genetic makeup, your sex, or your age, to those factors that really influence your health, but in a much more indirect way, like governance in the country in which you live, the policies of the government of that country, and the health and other interventions. Obviously, when we think about the big picture indirect issues, what we know is that if a government cares deeply about its people, believes in equity and equality of opportunity, then it will do more. It's likely to do more to enable the good health of its people, and invest in those areas that enable good health, like clean water and sanitation, than a government that's less interested. Clearly, a government that invests in the education of the girl child is likely to create a society that enables better health than a government that doesn't. So, and in between, of course, what we see is a variety of factors that have a pretty direct impact on health, as we know. We know that your health has a lot to do with the caring behaviors of parents. We know it has to do a lot with the physical environment in which you live. Do you have access to safe water, to sanitary disposal of human waste? Your health will also have to do, of course, with the circumstances under which you work. Are you working in an environment that's healthy, or are you outside working in an environment where you're exposed constantly to dust or to noise Are you working in a coal mine, which has historically been notorious for disabling health rather than enabling good health? We know that culture and your social environment, of course, also have a lot to do with your health. Are you from a culture that discourages smoking? Does your culture encourage exclusive breastfeeding for 6 months? Are you living in an environment in which your peers and those around you are eating healthy, or are they all eating relatively unhealthy processed foods while getting very little exercise? Now, what I want to suggest is that when we think about the determinants of health, we need to think about them as a continuum, moving from those factors and those determinants that have the most direct impact to those that have a more indirect impact. I would discourage you from spending too much time thinking about whether something is a direct risk factor for ill health, or whether it has to do with being a determinant of a social determinant. And instead, I want to encourage you to think more along, as I said, this kind of continuum. Having said this, I do want to note the formal definition of a risk factor, which is any attribute, characteristic, or exposure of an individual that increases the likelihood of developing a disease or injury. Examples of such risk factors include suboptimal breastfeeding as a risk factor for a range of childhood diseases, tobacco consumption as a risk factor for cancer, unsafe water as a risk factor for diarrhea, and a diet high in salt as a risk factor for heart disease. The formal definition of a social determinant is the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. When we think about social determinants, we can think about examples like the place of poverty in determining who might be exposed to tuberculosis. We can also think about homelessness and marginalization as underlying reasons why some people suffer from a range of health conditions that might include HIV and hepatitis. We can think about the low status of women in many societies and the impact that has on early marriage, frequent and closely spaced births, and violence against women. So as we think about your sex, your age, and your genetic makeup, and we think about your culture and whether you have access to safe water and sanitation, let's also be sure that we're thinking about what we call the social determinants of health and the broader forces that have to do with whether or not you're going to be enabled to be a healthy individual. Now, health services, I should say, matter. There's no issue. We know that access to good health services and services of reasonable quality can make an important difference. Two very important examples are immunization. We know that it's very, very important that young children be immunized against the vaccine-preventable diseases. They don't do this themselves. They seek these services from the health system. We also know that certain women will have complications of pregnancy, and it's very important that they have access to emergency obstetric care. So we can't minimize the importance of a good health system that people have wide access to that provides high-quality services. We can't minimize the importance of that for good health. But at the same time, it's really essential that you understand this is only one of many factors, both direct and indirect, that will condition people's ability to be healthy or not. Now, I also want to suggest a number of perspectives to consider as you think about and try to assess global health issues. As you reflect, for example, on the lives of people like Ramesh, Juan, and Shireen from our vignettes. In a way, you can think of these as lenses through which I hope you'll take a look at global health issues. And I'm going to call them key perspectives. One is I want to encourage you to think broadly. If you think that health only depends on access to health services, you're going to miss why it is, for example, that people are healthy or not. 2 is I want you to think about the fact that in most places in the world, health is regarded as a human right. And there's a human rights approach toward considering the way in which people have access to health services, can use those health services, how they're treated by those services, and the extent to which they're involved in helping to determine their own relationship with the health system. I also want you to consider at all times value for money. None of you would buy a cell phone for $200 if you could buy the same exact cell phone for $100. And in health, it's equally important that we try to ensure that we're investing as wisely as possible and buying the maximum gains in health at the least possible cost. And I want to suggest, in fact, that some people believe that when using public funds, we have an ethical obligation to do that. We have an ethical obligation to ensure that when public funds are spent, they're spent in ways that buy the maximum health at the least possible cost. Now, at the same time, we have to consider ethical ways of allocating scarce global health resources. As we spend money in ways that maximizes value and maximizes the health gains that we can get, we also need to consider a range of ethical issues, including particular concern, for example, for poor and for marginalized people. We also have to keep in mind at all times issues surrounding globalization in health. There are issues that are in our own control. There are issues that are in the control of particular governments. But there are a large array of global forces at play that help to condition whether or not people are healthy. Tobacco companies, for example, are doing all they can to sell cigarettes in a large number of countries, including from time to time suing countries for the right to do that as freely as they might wish. Some of these forces, and patents might be another area, go beyond the ability of individual countries to control, and we need at all times to think about issues related to globalization and health. I also want to suggest one other framework for you as you think about key global health issues. As you do so, I want to encourage you to think about 5 questions that much of the time, I think, will help you to consider these issues in a very orderly and simple way that will allow you to go from identifying a problem on the one hand to thinking about how it is that problem might be solved on the other. First, what's the nature and magnitude of the problem? What's the problem? Is it tuberculosis? Is it HIV? And how bad is it? Second, what groups are most affected? Is it poor people or better off people? Is it urban people or rural people? Is it better educated or less educated people? Third, what are the risk factors and related social determinants? Why do people get this particular problem? Are they getting tuberculosis because they have a genetic predisposition? Or are they getting TB because they're exposed to someone who had it and they're living in crowded circumstances and they're very poor, not so well nourished, and more likely to succumb to this than others are? What are the health, social, and economic consequences? In a way, you could say, why should we care about this? What are the health, social, and economic consequences related to this particular disease that affects these people for these reasons? And finally, what can be done? As we move from identifying the problem, we want to finally wind up with what can be done. What are the least cost, evidence-based solutions for addressing the problem? My students know that these are what we call Professor Skolnick's proverbial 5 questions, but I want to encourage you strongly to put them in your mind, keep them in your mind, and use them as guides to thinking about many of the questions that we'll be discussing in the course. And again, it's what's the problem? Who gets it? Why do they get it? Why should we care? And what can be done about it? We've begun to think more earnestly about real people in different parts of the world and their health circumstances. We've also considered the factors that determine their health and some perspectives we can take to thinking about critical global health issues. In the next session, let's talk about key actors in the global health arena.